Join me as I dive into the world of vaginal dryness and uncover the real causes behind it. Vaginal dryness is actually more common than we think, and it is important to talk about it right now as it can affect not only your sexual health but also your overall well-being. Do you know that 17% of women under the ages of 18 and 50 years experience vaginal dryness during sexual intercourse? Vaginal dryness happens when the tissues in your vagina is dry, thin, and are no longer well moisturized, leading to pain and discomfort during sexual intercourse. Vaginal dryness can occur at any age, but it is more common during and after menopause due to decline in hormonal levels. The main cause of vaginal dryness is usually the decline in estrogen levels, which happens during menopause. But sometimes you discover that people, even right before menopause sets in, are already beginning to experience vaginal dryness. Your vaginal dryness needs to be addressed because if left can cause pain and discomfort even while sitting, during sex, during exercise, even while urinating, and in some extreme cases it can result in vaginal bleeding. So, are there some factors that can lead to or contribute to vaginal dryness? Hi everyone, my name is Emily Snenye. Welcome back to this channel. If today is the first time of stopping by, I appreciate you. Please do well to like this video, hit on the subscribe button so you join this family. Each time we upload a new video, you get notified. If you're a returning subscriber, I appreciate you so much. All right, so in today's video we'll be looking at the causes of vaginal dryness, its diagnosis, and the remedies to this. Okay, so the number one factor that can lead to vaginal dryness is age. The cause of vaginal dryness is the gradual decline in estrogen levels. This can happen with age or as we approach menopause. Menopause is the permanent cessation of menstrual period, so that you can no longer get pregnant without assistance. And the best time to find out to know if this decline in estrogen level is the cause of a hormonal balance is by running a hormone profile test. And the best time to run this test is on the day 2 or the day 3 of your menstrual cycle. I'm sure you know when the day 2 or the day 3 is. That is when you are still bleeding. The very first day is your day 1, day 2, or day 3 is the best time to take this day 2 estrogen test so as to get a very good result. I do have a video in this my channel where you can learn how to properly calculate your cycle length, your ovulation, and fertile window. You can check it if need be. All right, so another reason that can lead to vaginal dryness is breastfeeding. This is because during breastfeeding the hormone prolactin is very high, and prolactin has a negative feedback on estrogen. Once your prolactin is high, your estrogen is bound to be low naturally, and once your estrogen is low, symptoms of menopause begin to appear, and vaginal dryness is not left out. Another reason that can cause vaginal dryness is uncontrolled diabetes. Uncontrolled diabetes is just excess sugar in your bloodstream, and this can cause damage to the blood vessels that supplies to the vagina, causing dehydration and dryness all over your body, which your vagina is not left out. Another reason is an autoimmune disease called Sjogren's syndrome. This causes total dryness all over your body. It causes generalized body dryness. And once all your body parts are dry, the vaginal lining tends to be dry as well, and you experience this pain and discomfort during sexual intercourse. Another cause is use of birth control tips, control pills, especially certain hormonal birth control pills. It is best you speak with your doctor before taking any birth control pills, especially hormonal birth control strips, so that he will ascertain your body and know the one that is best for you. All right. Another one is cancer treatments such as radiation, chemotherapy, and even some hormonal therapies. They have a way of causing vaginal dryness. Another cause is oophorectomy. This is simply the removal of the ovaries, and once the ovaries are removed, it leads to loss of hormones and the individual comes down with vaginal dryness. Also, use of certain medications such as antihistamines, antidepressants, and certain anti-estrogen therapies used in the treatment of uterine fibroids and endometriosis can equally cause this vaginal dryness. Then, lack of foreplay prior to sex. It is essential and very necessary in order to stimulate the necessary nerves that will bring about the needed lubrication for sex. It is very important that adequate foreplay is first of all initialized so as to make sure that you don't induce dryness due to lack of foreplay. Another reason is douching. I've talked about douching in one of my previous videos where I talked about recurrent yeast infection, how it causes how it can contribute to your having recurrent yeast infection. Here again, we are talking about it as one of the causes of vaginal dryness. Use of scented perfumes and scented soaps in washing the vagina. I've said it in my previous video that the vagina is not supposed to be washed as it is self-cleansing. So here again, we're mentioning it that douching is bad. It can contribute to vaginal dryness. So avoid it when you can. Do not douch. Rather wash the vulva, the surrounding areas of the vulva. All right. And lastly, smoking. Smoking has a way of messing almost every part of your body, your lungs, your heart, and some other vital organs such as your liver as well. Here again, women who smoke, it has been observed that women who smoke tend to approach menopause earlier than they should have. And once you're coming down with symptoms of menopause, vaginal dryness is one of them. It reduces and brings down your estrogen level and you begin to experience vaginal dryness. All right, so if you're still watching up to this point, please give this video a thumbs up and subscribe. All right, have you subscribed? It's just a click. Just tap it. All right, thank you. So remedies for vaginal dryness. Of course, there's actually something you can do to make sure that you don't experience vaginal dryness, or at least you take care of it from reoccurring. One of them is stay hydrated. You need to take water. Make sure you're hydrated. Take enough water. Take fruits and vegetables that are water-based. At least this helps your body not to be losing its moisture. It helps your body to retain moisture. So make sure that you stay hydrated. Being hydrated doesn't mean gulping juices and all these canned juices and all that. Take fresh fruits, take water. Don't allow yourself to get thirsty. Randomly drink water to satisfy your thirst. It has a way of keeping you very clean and detoxified as well. Another remedy is, this is a temporary remedy anyway, is use of lubricants. All right, if you're trying to conceive, it's not every kind of lubricant you use. You don't use the one that will be spermicidal and trying to kill the sperm cells that's supposed to fertilize the eggs. So if you're trying to conceive, I suggest you use Proceed lubricants by Carrot Stop Drugs. And if you're not trying to conceive, you can use KY jelly. So another remedy is foreplay. Make sure you initiate foreplay before every act of sexual intercourse. And then uncontrolled diabetes. Keep your blood sugar on check so that it doesn't cause generalized dehydration. So talking about drugs, there are some localized estrogen therapy that your doctor can prescribe to you to effectively treat this condition. All right, so that you achieve your desired results. Okay, so when do you need to see your doctor? If you've tried some of these remedies mentioned herein and you still get pains, you still get discomfort, especially during intercourse, and when you see it, or just maybe you get vaginal bleeding during intercourse, then you really need to see your doctor so it can be tackled once and for all. In conclusion, vaginal dryness is not something to be ashamed of. By understanding your body and seeking help on time, you can combat this, and you're not alone on this. There are a lot of people that are experiencing this, so seek help on time. There are a lot of treatments that will effectively take care of your condition, and you take back your sexual health and your overall well-being. All right, thank you so much for coming with me on this journey into the world of vaginal dryness. I do hope you found this video helpful. Please drop your experience, your questions, and your thoughts in the comment section. I will definitely reply them and attend to all of them. Okay, so, and if you're interested in health and wellness tips, please do well to subscribe so that each time we upload a video, you get notified, you carry you along. Until I see you again next week. Thank you for watching. Bye.